Good evening, everyone. I'm Councillor Sonia Winifred, the Cabinet Member for Equalities and Culture, and welcome to our event this evening, Let's Talk About Vaccines, and a warm welcome to our professional panel members who are here to answer your questions. Some of your questions have been posted beforehand, but you are also welcome to post questions during the event. This event has been arranged by Lambeth Together, NHS and Clinical Commissioning Group and Lambeth. Now, we will be focusing on the Black, Asian community, minority ethnic communities who are disproportionately targeted. I use the word targeted because it seems the COVID-19 pandemic seems to have targeted this community. We know that despite making up only 14% of the population, these groups are most likely to be on the front line. We've asserted that. And other NHS workers, shelf stackers, supermarkets. And we know that at around 40% of doctors and 20% of nurses are from BAME backgrounds. We've seen the data, we know the stats, yet it seems this particular group are vaccine hesitant. This is the media and myself, having spoken to several people in the community from this group, that they are hesitant to take this vaccine. There is evidence to suggest that the disparities between these different communities and their willingness to take up the vaccine, Black African Caribbean communities, followed by those from Pakistani and Bangladeshi communities, are least likely to say they will take up the vaccine when offered. According to research studies, vaccine uptake data show that while rates of hesitancy are decreasing, take-up is still uneven across people from different ethnicities. This is of concern in Lambeth. That's why we're here this evening with this event. And Lambeth has a large African and Caribbean population that has already been disproportionately impacted by the pandemic, as I've stated. This is of concern that inequalities in health will widen further if uptake of the vaccine in the Black, Asian, minority ethnic communities is not widespread. Now, we have our panel this evening who are professionals and will be answering your questions. I hope when the event is over this evening that you will feel we've answered some of your questions, and if not, I think we will make it possible for you to pose further questions. And of course, you have your local GPs, healthcare professionals that I hope you have access to, where you can get further information. So I would like to begin now by inviting my panel members to introduce themselves. So if I can start with Professor Kevin Fenton, if you could tell us a little about yourself.
Hi, good evening, everyone. I'm Professor Kevin Fenton. I'm a medical doctor and the Regional Public Health Director for London. I have been working on and leading the public health response to the coronavirus in the city. And I've also done work on coronavirus and its impact on Black, Asian and minority ethnic communities. Looking forward to the conversation this evening.
Thank you very much, Professor Fenton. And can I ask Dr. Ray Chaudhuri to tell us a little about yourself?
Hello there. My name is Professor Ray Chaudhuri. I'm a neurologist. I work at King's College Hospital in London, and I have a specific interest in neurodegeneration and long-term neurological conditions, but also I'm very actively involved with the vaccine and related COVID-19 studies here at King's College. I'm also particularly closely associated with the issue about diversity in research and vaccination, as well as COVID-19 studies.
Thank you very much. Can I ask Dr. D. Aitken, could you tell us a little about yourself, please? Dr. Aitken, there you go. You're muted. Can you hear us? Dee, are you with us? No? Okay, while we're waiting for Dr. Aitken, if I could ask you, Reverend Bowman, if you'd tell us a little about yourself.
Reverend Canon Ivelaw Bowman. I have been resident in Lambeth for many years. At one time, after my retirement from the civil service, I was the Borough Mental Health Chaplain for Lambeth, working on the SLAM, as most of my pastoral work has been in South London, in the various hospitals, and I am very familiar. I'm not an expert on health and well-being as it affects our people of African descent and the history of science, health and well-being, and our people.
Thank you very much. Dr. Aitken, are you back with us yet? No, in that case, could I ask you, Juliet, to say a little about you, please?
Yes, thank you. Good evening, everybody. My name is Juliet Amoa. I'm the Associate Director for Community Health and Engagement. I've been working in Lambeth for over 30 years and I also live in Lambeth. I've got a particular focus on reducing health inequality for the Black, Asian and minority ethnic communities. So yeah, trying to really work to engage and look at the issues around health inequality, but clearly particularly at the moment around COVID-19 and vaccines. I'm going to hand you back to Councillor Winifred. Thank you.
Thank you very much. Fenton, could you tell us about yourself?
Thank you, Councillor Winifred. Good evening, everybody. My name is Fenton. I'm a public health consultant, a medical doctor by background as well. And I've been working in Lambeth for the last 20 years. I'm currently part of Ruth Hutt's team, who's the Director of Public Health, and we've been leading the local response on COVID in the last year. I'm handing back to Councillor Winifred.
Thank you very much. Dr. Aitken, are you back with us? Aitken? Dr. Aitken, could you tell us a little about yourself? I did see you. No? Okay, I think we'll move on when Dr. Aitken is able to join us again. I think this is what happens with, you know, technical hitches. So we have to expect this. This is the age of technology. This is what happens. So I'm going to now go to the questions, a couple of the questions that have been posed before. So again, I'd like to thank those who are listening in, to thank them for posing their questions as asked before, and as I said, they can still pose questions in the chat as we continue. So the first question actually is for was for Dr. Aitken. She's not with us yet, so I will go to the next question, which is for actually it's for you, Fenton. And it says here, I think it's more of a statement actually, and it's something which has come across our screens on the news, but no definitive responses from the government. It says, no jab, no job for Black workers. It's time to end blame the BAME and protect our rights to say no. Unacceptable, especially after we've been so poorly served by Tories' corrupt confusion that led to disproportionate failings for us on PPE. Racial trauma results in PTSD that is killing us. We must take joint legal action to compensate us. So what do you think of that, Fenton? What do you have to say?
Thank you, Councillor Winifred. So I think the main thing to say at this stage is that we are encouraging everybody to have the vaccine. It is safe and it is effective. I've had my vaccine. My father, who's 91, has had his vaccine as well, and a lot of my family members have had their vaccine. You know, we've all had it. The vaccine itself is obviously not a legal requirement in terms of UK law. However, some employers, as I understand it, may choose to make this a condition of their employment based on the assessment of the nature of the work and business. So, example, if you're providing direct patient care, there may be a requirement for people to have the vaccine, and that's partly to protect other people as well. And there are likely to be exemptions. Now, clearly, we're not an expert panel of lawyers here, so this panel cannot really give legal advice or speculate on the outcomes of potential legal challenges. I think the main thing is that we are encouraging people to take the vaccine.
Right, thank you very much. And I think at this stage, whilst we've had a taster for the questions, I think I would backtrack a little and ask the panel members to give us a summary of their work and how they fit into this programme. So I'll come back to you, Professor Fenton, and your role in vaccines in health.
Great, thank you, Councillor Winifred. Can you hear me? I was just... Yes. Great.
Yeah, I can't hear you anymore. Can you all hear me?
So we can hear you, Councillor Winifred, I think.
Oh, you're back again, Professor Fenton. Start again.
Yes, we can.
Good evening, everyone. Really pleased to be here this evening. I'm going to keep my comments brief because I think we're having a few connectivity issues as well. So, as I said earlier, I am a medical doctor and I'm the Public Health Director for London. I've been in this role for just over a year, and prior to that I was actually the Public Health Director for Southwark. So I've worked in South East London and I know the work that you do in Lambeth very well. This is an important time for us. Over the past year in London alone, we've had significant numbers of infections occurring within our city. We estimate that there have been nearly 700,000 people who've been diagnosed with the coronavirus in the city over the past year. And unfortunately, we've had more than 16,000 people who've died from this infection. So the coronavirus, the Covid-19 pandemic has had a severe impact on us as a city, as it has had on the UK. And as you've heard from Councillor Winifred, we know that in London, certain groups and certain boroughs have been disproportionately affected. In the first wave, residents in the city who were of Black Caribbean and Black African ethnicity had some of the highest death rates from the disease. And in the second wave, we saw a high proportion and high rates in Londoners of South Asian backgrounds, Bangladeshi and Pakistani ethnicity Londoners who were disproportionately affected. Now, this means that we're coming out of this second wave with a devastating legacy of the pandemic. Lots of people infected, significant numbers of deaths, and a disproportionate burden on Black, Asian, and minority ethnic communities. So when we look back on the year, and I remember this so clearly, when we were dealing with the first wave, when we were going through the second wave, we were all saying to each other, my goodness, I hope there's a vaccine that is available for us soon. I hope there's something that can help us to bring this pandemic to an end. I hope there's something that I can give to my parents, to my loved ones, to protect them from becoming infected and dying from this disease. And I think this is such an amazing time for all of us. And it is such a privilege to be living at a time when we now have availability of this highly effective vaccine, availability of a very safe vaccine, and an ability and availability of the vaccine, which is being provided free of cost for us all to take advantage of. Now, I'm really pleased because I took my vaccine 3 weeks ago. I had the AstraZeneca vaccine, and I can't tell you just how emotional it was for me at that time, in part because having lived through the pandemic and seeing the impact on so many communities, this was a really important time for me, not only to protect myself and my family, but to contribute to protecting Londoners as well. And yes, like everybody else, I had questions about the safety and effectiveness and the content and the delivery of the vaccine, but I listened to the experts and I've been briefed by the experts and I've seen the science, and I know that this is a highly effective tool and one of the most powerful tools we have to protect ourselves. So in closing, one of the things I'm often asked as I do events such as these is, Prof, why should I take the vaccine? What's in it for me? Well, I want to leave you with just a few things that I've certainly learned over the past few months. And speaking as somebody who has had the vaccine, here's what I would say to you. Number one, the coronavirus is here to stay. It's not going anywhere, and we're going to have to learn to protect ourselves from it and to learn to live with it. And we can't stay locked in our houses forever. We have to get back out into society, back to work, back to living our lives, back to seeing our family. And the vaccine is the most powerful and the most effective tool we have to help us to do that. Second, the death and illness that this virus has caused is far worse than any side effect that you'll have from the vaccine. In fact, the side effects are very low. It's safe, effective, with a very good safety profile. And even although there may have been some concerns about the AstraZeneca, you have heard that, again, the UK government or regulators and the European regulators have said the vaccine is safe and it should be given. And so, especially for young people who think there's no risk, remember long COVID and the complications of COVID are a challenge. Third, it is more safer to get the vaccine than to get the disease itself. So again, bear that in mind in terms of the risk profile and the benefits and the costs of having the vaccine. And then finally, remember that the vaccine prevents from severe disease and death. And there's increasing evidence that when you have the vaccine, it will reduce your ability to transmit the virus to others. So you become part of the herd immunity. You become part of helping to reduce transmission within our city and protecting our loved ones. So Councillor Winifred, with that, I'm going to pause my reflections on where we are. Very happy and look forward to the questions this evening.
Thank you very much indeed, Professor Fenton, and I'm glad to see you're leading by example. You've taken the vaccine, that always helps. It's brilliant. Thank you very much. Dr. Aitken, are you with us yet?
Can you hear me now?
Yes, I can hear you.
Excellent,
I can hear you.
thank you.
Okay, sorry, we missed you earlier. Could you tell us a little about yourself? And you're going to, it might as well use the time to talk about your experience of working as a GP in Lambeth. And we know you've been here for a long time. We appreciate you. We're having difficulty. We're having problems hearing you.
Oh, and I'm going to turn my camera off because it keeps cutting out when the camera goes on.
All right.
I've been a GP living and working in Lambeth for the past 30 years. And this last year has been unlike no other. My other role is working for NHS South East London CCG. So for the past 25 years, I've always had a managerial role, and currently I'm the assistant chair at the Clinical Commissioning Group. That's what CCG stands for. So as I said, the last year has been a year like no other. It's been really distressing to see families and communities that you've known all this time being impacted by the coronavirus. My practice looks after some care homes, and the care homes were impacted by coronavirus. And then, of course, my own friends, family and networks, when something like this has happened, they've all turned to me for advice. And I've had one friend who's had 4 work colleagues die. He's a driver, he works driving taxis, and 4 black male black taxi drivers died early on in the pandemic, which was really tragic. And I've had another friend in ITU. And so, when the vaccine came along, at first I was like everybody else, how come the vaccine came along so quickly? And then I learned that actually it was because loads of people had volunteered for the vaccine trials, even local GPs in Lambeth. And then I learned that even though they'd been developed quickly, no corners were cut. And in fact, the MHRA, the Medicines and Healthcare Regulatory Agency, is extremely stringent on their standards. And so I learned that the standards for approving this vaccine were second to none. And so when the vaccine came along, I was willing to take it. So being a healthcare professional, and plus also I have some underlying conditions, I was one of the first that was offered, because we come into cohort number 2. So I had the Pfizer vaccine, which suited me just fine. Yeah, I had a slightly sore arm the next day, but nothing more than that.
Right.
With regards to friends and family, I could say that somebody asked me to talk about my mum, so I will talk about my mum. She's very frail, elderly. She has Parkinson's disease, and she needs carers who come into her house 4 times a day. So we were all petrified that she was going to catch coronavirus, but luckily she did not. And so she has had her vaccine as well. She was called up. She doesn't live in Lambeth. She lives in northeast London, in a borough that has a very high prevalence rate. So she, her carers used, they was absolutely stringent about keeping their face covered, washing their hands, keeping a reasonable distance for her where possible. And she got through that period and has been able to have her vaccine, and she's having a second one, I think, next week.
Wonderful. Brilliant. Thank you, Dr. Aitken. Dr. Chaudhuri, could I ask you to tell us, because you're working the vaccine development, so, we're anxious to hear what you have to say.
Hi, hello, Councillor Winifred and Juliet and all the panel for actually asking me to to speak today as the NHS frontline person who's been in the front line really since last March, and thankfully all I can say is that the vaccine has brought in a major positive feeling amongst us health workers, because, to be honest, it is really, and as was mentioned by Professor Fenton, remains the way out. Now, I know that many of you might want to look at some actual data in a bit more granular fashion. And so I've got a few slides, and I thought I could just share actually, and then finish it up with a little bit of a personalized context. As you will see that I'm of Indian origin. I'm first generation Indian, came here from Calcutta in the late 80s. And I've had several experiences of people who had suffered from COVID-19 and some with not the ends. And I believe very firmly that that could have been avoided should the vaccination be available at that stage. So I'll end with that story. Okay. So I'll just share my slide now. And sorry, where is it? Oh, this one, yeah. And I hope you can see.
Sorry, I can't see.
Here we are. Okay. You're on
now. Can you see that?
Yes, thank you.
Excellent. It should say SARS-CoV-2 vaccines, where are we? Yeah. And I'd just like to start off with the fact that there is a lot of, the reason we are having this webinar is because there's a lot of hesitancy, a lot of doubt, a lot of, shall we say, mistrust in the whole vaccines messages. But vaccinations work. And this is something I've taken from polio vaccine. And what you see here is that that in blue is the vaccine for polio that came through, and in red you have the rates of the condition, and you know what a devastating condition polio might be. But what it's telling us, that as soon as vaccine was available, and of course they do have some side effects and so on, there's no drug in the world without side effects, but you see the dramatic fall and the devastating consequences of this condition. So this is not COVID-19, but this is an analogy. And if now
sorry, Dr. Chaudhuri, you might want to go down to the next slide. I think we're still on the first slide.
Okay, I think, can you see, sorry, can you see this one?
So yes, where now vaccines do work. Yes. Perfect.
Okay, I won't put it on full screen show. I think maybe that's slowing it down. I'll just leave it like this. So I think broadly here, what I was trying to say is that the blue line is when the vaccination started, and you can see in red line as the condition fell off and petered out completely. So you can see how the effect of vaccine, even if you don't believe the COVID-19 vaccine story, you see that we have this analogy from polio. It's a different disorder, completely agree. So let's now look at COVID-19 itself, and you might be slightly confused by the different types of vaccines that there are, or it's been there in the media and elsewhere in the social media and so on. So the vaccines that we have currently and that are related to COVID-19 vaccination that we can have are broadly summarized here. You have the viral vectors, and in this situation what happens is these are viruses that can cause symptoms of flu or common cold in either humans or in chimpanzees, and these are called adenoviruses. They do carry this DNA for SARS-CoV-2. This is then introduced into the host cells, and this then mounts an antibody army that then goes attacks this virus, and therefore it builds up your own resistance against the COVID. Now, it doesn't mean, however, that this means that you're actually being introduced actual material from chimpanzees, for instance. So it's purely a virus which doesn't actually cause illness in humans. That's being introduced to mount this response, this antibody response. And the example, the closest one to us is the AstraZeneca, the Oxford vaccine, which is based on this particular principle. Then you have the two others, that the DNA vaccine or the mRNA vaccine. This goes into the genetic material. So they deliver the pathogens genes, so the genes of the CoV-2, the virus, the COVID-19, into the host cells. And this is either DNA or messenger RNA. This then tells the host cells to produce a virus type spike proteins, and then it produces the antibody against. And the classic ones which are relevant to us are the Pfizer and the Moderna vaccines, are both based on this particular principle, but there is also another one called Inovio. And then you have some other ones like the RNA and the protein virus. These are actually particles, this is based on the science of particle-based vaccine, where the protein is attached to a little particle, which is usually in the form of a virus-like particle, and then introduced, and then it mounts the antibody response. So the broad idea is still the same. You're introducing something similar to the coronavirus, COVID-19, without causing the disorder, and getting the body to get ready to mount an attack should there be an infection with COVID-19. And Novavax is another vaccine that will come our way at some stage, is based on this particular mechanism. And then finally, there are the killed viruses. So these are killed viruses which are developed, and then they are introduced, and they then mount the antibody response. This is not available here, but the Chinese and the Indian viruses have been based. The Chinese and the Indian vaccines have been based on this particular mechanism. So that's a sort of summary. And if I just want to tell you, in case you wanted to know about messenger RNA, in red is the synthetic sequence. This has the instructions. This is then through a nanoparticle introduced into the cell. The cell then develops this spike protein. This then develops the antibodies that you can see here. So that's how that's working. So this is Pfizer, this is Moderna. And here you can see that the Pfizer and the Moderna, that the two we have, are very, the thing about them are there are two doses, as you know. With Pfizer, the issue, the technical issue has been storage. It has to be stored at -70, and it has to be administered within 1 day of thawing. So you need to have the logistic side reasonably secure. Moderna is similarly storage at -20, and it's slightly easier, can be stored in fridge temperature for up to 30 days. If you now go to the AstraZeneca one, I've already explained the mechanism, how this is working. The advantage of this is that although it needs 2 doses, you can actually store them at this normal fridge temperature. So it's a lot easier to deliver. So I think I'll stop with the vaccines there. That's a broad way of how the vaccines have been developed. As I said, we've not talked about the vaccines that are not particularly relevant to us. So if I stop sharing there, and let me just stop sharing. And then really coming back to the last bit that I said, that having worked in the vaccine and having taken part in 2-3 trials, I can say that the data, and although some people will be concerned at how quickly these vaccines have been produced, the technology going behind them is absolutely stupendous. And we've learned from all the different vaccines that we've developed over the last 2 decades, for instance. And I can also say that that I myself have had 2 vaccines, both doses. And while there is a simmering sort of background of safety, there's a lot of stuff going on in social media as well. I think the side effects are generally quite minor. You might get a bit of a flu-like illness. You might get a bit of fatigue. I had some tiredness on the day after I took the vaccine, but it cleared up. Some people get a reaction after the 2nd dose, maybe not the 1st dose, but really not a lot else. And all the serious material that you read, really the risks of having COVID-19 or from other sources far outweigh those particular risks, and perhaps we can address that when we come to it. I'd like to end by some personal stories that, I've had 3 members of my family affected. My sister-in-law, who I was very close to, sadly died, and she actually had a respiratory condition, and this is the particular thing. A lot of us, certainly in the Indian community, have comorbidities, and I think this goes across the minority ethnic communities. Diabetes, high blood pressure, body weight, increased body weight are all pretty common, and if you have those problems, COVID-19 becomes even more dangerous. And I think this is where vaccines have an incredible role really to take us out of this pandemic. And I similarly, I've had 2 other friends I've lost. Both of them had comorbidities, and in fact one of them I was in touch with. He was in India because there was no vaccine available there. I remember having a conversation, and he was even contemplating if he could travel to the UK to get vaccination. So that is the situation. So I would really strongly encourage everybody. We are here to try and address as much as we can with some evidence base, but broadly, I think we have to go the vaccine way to get out of this pandemic, as has already been echoed. So I think I'll stop there. Thank you.
Thank you very much, Dr. Chaudhuri, and for addressing the mechanisms of the vaccine, how it works, and I'm sure there are people who are very interested in that, and also touching on the speed of the development of the vaccine, which is of some concern. I know that some people have raised some concerns, but I'm sure there'll be questions relating to that when we go to the questions. So thank you very much. Reverend Bowman, you're on now. Thank you. You're going to tell us a little about your experiences with your congregation and how, managing this conversation.
Presently, thank you very much for, dare I say, elevating the level of this conversation. I haven't got a congregation at the moment, but many persons ring me every day, and I'd like to use the word guardedly. They trust me. And it is the same question every day. Should one take the vaccine? And my answer to that is always yes. And why yes? I must thank Professor Kevin. He spent a lot of time on the television. And when this came about, I questioned my GP, Dr. Gupta from Sanmere Practice, concerning the efficacy of this vaccine. and I must thank him. He convinced me that it is in my best interests so to do. And I've had the Pfizer vaccine at Guy's Hospital, and unlike Dr. Chaudhuri, you know what? Nothing has happened. And I pray God that I'm awaiting the second dose in April, and I hope the same thing continues. But as I've said, I spent a lot of my time also trying to dispel myths, conspiracy, and misinformation. And this, the experts have to take on board. There are lots of myths, conspiracy, and misinformation. But despite all of that, the vaccine is creditable. It is painful as a priest. It is painful to see members of my community whom this virus have affected, especially people of color from the Black and minority ethnic community. I must say tonight that the church has to redouble its effort in educating their congregation regarding the efficacy of the vaccine. Speaking for myself, that efficacy is beyond question. And I think that the church community have to do some more work. The vaccine assists us in building up immunity to the pathogen. Then it's worth the effort. And let me say this, I have to play my part. We all have to play our part. Put simply, every member and resident of this borough must see to it they are vaccinated, especially persons of color, not only for the good of oneself, but the good of the entire community. None of us are safe until the entire community is safe. And lastly, it is of vital importance that we all heed the guidance of our scientific experts. Science have provided the guidance. As people of color, we must now play our part in following the guidance and not be distracted. Yes, I know the history of science and our people, but we must not at this stage be distracted. I think I'll stop there.
Thank you very much indeed, Reverend Bowman. And just to add that, yes, the church is doing, must do better or work together, and certainly Faiths Together in Lambeth have been doing just that in supporting the communities and answering their questions. So they've been leading on this a lot longer than we have. So there's been other community events led by the churches, I'm happy to say. So thank you very much indeed. I think I will now return to the questions, and we will refer to some of the questions that have been submitted in advance. And I think the first one I have here is for Dr. Aitken. Are you with us, Dr. Aitken?
I'm still here. Hopefully you can hear me but not see me.
Yes, I can hear you. That's good enough. Thank you. So the first question for you is, after receiving the first AstraZeneca vaccine, now deemed to have some possible minor side effects, can we opt for a different second vaccine injection? Very good question.
Yes.
Did you get that? Yeah.
I did. Yes, that is a good question. And today I did, knowing that I was coming to this webinar, I did have a look to double check my potential answer to this question, but as far as I'm aware, there's no evidence yet based on any trials around efficacy of mixing up your vaccine doses. And I've had several questions from patients over the last few weeks, and I had a patient ask me this very question this morning, and I've had to advise her that she should stick to the same dose of vaccine, the same brand of vaccine that she had for her second dose. So this lady had AstraZeneca, and so she wanted to change to Pfizer, not because of clots, because she thought her side effects were too much with one. So as far as I'm aware, there are no completed clinical trials yet that allow us to say it's okay to mix the vaccine brands.
Yeah, just say one point on that. Thank you. There is an update. The University of Oxford is actually doing a trial called the COMCOV trial, and they're actually looking at the effects of combining two vaccines. Before we have the data from that, this is in about 800 people, and that data might give us more clarity on this particular question. But I totally agree. Till then, it should really be
safe to continue the same. Thank you very much, both of you. The next question is for Professor Fenton, Hitton, or Dr. Aitken. All three of you actually may contribute. And it's this: as a patient previously prescribed the contraceptive pill for many years, why wasn't the possibility of potential blood clots mentioned alongside all the other side effects when I received the first dose of COVID-19 vaccine? So whoever, Professor Fenton?
Yeah, I'm happy to start. So remember that we are rolling out a very new vaccine, and it's one of the most successful public health programs we've ever had in this country. And within a space of 4 months, we have nearly more than 25 million people in the country who've received the vaccine. You know, as we are delivering the vaccine to so many people, we are actively looking at the safety profile of the vaccine. And if there are any signals of anything of concern, then that goes to the regulators, and then more investigation is done. So when we started the implementation of the vaccine, there was no evidence or concern that the vaccine causes clotting. So it would not have been routinely brought up to any patient as a side effect. And in fact, despite the concerns that were raised in Europe over the past fortnight, the regulators and the scientists have again come back and said there is no evidence that there is a higher level of clotting that you see with the vaccine than you see in the general population. So the reason, in summary, why you probably weren't told about clotting is that it was never a concern, and it still isn't a concern today. And we will continue to monitor the side effect profile of the vaccine. And if we need to change clinical advice for any reason, for any vaccine, we will do that, because we're monitoring the situation very closely.
Thank you. Thank you. Aitken?
The only thing I would add is that that the UK has a very good system of monitoring, and it's called a yellow card system. So if people are concerned, they can talk to their GPs and complete the yellow card notification for any other side effects that may come out. So it's a way of monitoring, which is very important. But it's a very comprehensive system.
Okay, right. Dr. Aitken, did you want to add anything to this?
I don't think I've got anything further to add. All GPs know how to do the yellow card notification, so it's really quite easy. Yeah.
Right. Thank you very much.
Can I just come in here?
Yes, of course.
Reverend Bowman, I'm glad that the yellow card system has been mentioned. I'm thankful for that. Let me just say this. I'm a layman, and I depend on my doctor, my GP, my consultants. I'm a cancer survivor. And it is not right. I think that the government and the health authorities in this country hasn't hidden anything from us. I may be a trifle naive or come over as a trifle naive tonight. I don't think that the government has hidden anything from us. And concerning our brothers and sisters on the continent, it is very bad to play politics with people's lives. People's lives are important, and I concur with what Professor Kevin has said. People's lives here, we are talking about people's lives. In the end, The continent has said exactly what this government has said. The efficacy of the vaccine is sound. Thank you.
Thank you very much, Reverend Bowman. And may I say, you don't come across as naive at all, just very passionate. Thank you. Going on to the next question is for Professor Fenton and Dr. Chaudhuri. And it's this: what is the vaccine made of? Is the vaccine safe to take? What side effects are common and how common? Are there any side effects that, if they present, should result in you immediately seeking medical assistance? I'll just read a few more. Some people have had more side effects, aches and pains, with the second dose than the first dose. Is this common, and why is this the case?
Dr. Chaudhuri, would you like to begin? This is your specialist area.
Thank you very much. Thank you. This is really extensive questions. I'll try and address, and then Professor Fenton, I'm sure, will pick up. I think coming back to the clotting issue, one thing I'd really like to say is that you have to remember the rates, and I really applaud what Reverend just said. The rates of clotting as described, the clotting disk problem has been 3 in a million, 3 to 4. And that particular rate is far, far smaller than many other conditions that we might have risk from other medications and other drugs. So we have to keep it in the context that, as we heard, it's a new vaccine. So of course there's a little bit of an unknown, but I think really nothing has been hidden. There's a lot of social media stuff that's going on about the vaccine and what is not being told. But to be honest, I also do not subscribe to that. I think we know as much as we can, and it seems perfectly safe. In fact, as safe as a flu vaccine, which people take every year. In relation to its side effects, the general side effects are similar to any vaccines of this nature. So you can have local site pain. It's actually very common. I had it myself. And then as it's a mild inoculation of this particular virus, you might feel a little fluish. You might have a little problem with just even mild temperature and mild cough. What I had particularly was none of that. Pain, which resolved after 2 days, and also a little bit of a sense and feeling of fatigue. And we've seen that in many people in our vaccine studies as well. When you go to the second dose, it's also very similar. And in fact, in some people, the second dose, if you've had a response or a reaction to the first dose, the second dose is actually even less obtrusive in terms of its side effects. So largely those 3 things: pain in the local site, you don't normally get swelling, you can get a bit of a temperature, maybe very mild cough, and a sensation of fatigue. When I say fatigue, it means tiredness, like, you know, you're really tired and you just want to rest for a while, and again passes away after a day or 2. And it's worth saying, after any viral infection, you might get a bit of fatigue. So post-viral fatigue is very well-known phenomenon. So those are the main things that we see. I've also, being a Parkinson's doctor, I have also had videos sent to me by people who've developed abnormal movements after the vaccines. And I have to say they're not actually what we call organic movement disorder. And these movements also disappear. And usually they are very, very rare. And to my knowledge, it doesn't actually occur. So I think it's worth remembering. So I give it a clean bill of health from that point of view. Of course, the longer term effects of the vaccines, we'll have to wait and see, but I don't really see any specific concerns here. So I'll pass it on to Professor Fenton.
Great, thank you, Prof. Chaudhuri. I just had 2 things just to reinforce. So regarding the effectiveness of the vaccines, I think it's such an amazing point that a year after the pandemic has started, we now have these vaccines which are so effective in preventing severe disease and death. And in a sense, it doesn't matter which vaccine you get, we're looking at very high levels of effectiveness preventing severe disease and death. So whether you get the Pfizer or AstraZeneca or the other ones which are being approved, this is really, really good news. And you know, Professor Chaudhuri will know that, and Dr. Aitken will know that previously when we give, for example, the flu vaccines every year, we often speak of a much lower level of effectiveness than what we're having now for the coronavirus vaccine. So my first thing is it's safe, and second, it's highly effective. The third reflection is whichever vaccine you are offered, take it, right? Don't wait in the market until you think you're going to get a better one, because there's no benefit. All it does is that it delays your time for being fully protected with the vaccine. So when offered the vaccine, please take it up as soon as you can, because it gives you the best level of protection. And then the final question I'm often asked, Councillor Winifred, is, you know, did the trials include lots of people from Black, Asian, and minority ethnic backgrounds?
Yeah.
So how can we be reassured that, you know, as they were developing the vaccines, they tested it on people of our background? And I have some data here on the major vaccines which are available: Pfizer, the Moderna, and the AstraZeneca vaccine. And again, the proportion of people of Black ethnicities were very high in the Pfizer and Moderna vaccines, and certainly for Hispanic and people of Asian backgrounds. So in all of these trials, we see between 20 to 35% of participants being of Black, Asian, and minority ethnic backgrounds. And that's really important because it has been tested in a very diverse group of populations. We know it works and is equally effective in everybody. Thanks.
Okay, thank you very much. Does anyone care to add anything more to that? Thank you very much. Well, that concludes the submitted questions. So the previously submitted questions. So I'll now look to the chat to see what's in store for us all here. So, okay, so what I will do is to pass these questions along. There's no, you know, as it comes, and the panel can answer as if you feel you're able to contribute. It says here it is asking about whether we know the percentage of people with asthma that have undertaken the COVID vaccine, and were there any side effects. So I suppose this is about those people with underlying medical problems, whether the vaccine is safe for those groups of people. So I think, shall I call out a name then? Dr. Chaudhuri, I'll give that one to you.
Yeah, I think you mentioned it yourself, Councillor Winifred, yeah. And again, Professor Fenton as well, that because the inoculum is pretty safe, even if you have asthma, it's not a contraindication to taking the vaccine, because it is unlikely to bring on an asthma. So as long as you just continue with your normal asthma treatment, taking the vaccine should not be a problem.
Okay. Anyone else want to add? Is that okay?
I think just to say that you brought a point though, in our community, we know that there are many people who have chronic conditions, right? So hypertension and diabetes. We know obesity has been a risk factor for severe disease, including asthma, sickle cell disease, and so forth. And again, what's really fantastic about the vaccine is that we know that it has a very good safety profile, and the fact that people who are clinically extremely vulnerable have been prioritized to receive the vaccine, and we are having no reports of any adverse events, really gives me and encourages me about the safety profile. So we know that the government is confident enough, and the MHRA, in the safety of the vaccine, so it's given to the most vulnerable by age, but also people who have these clinical conditions. So just to reassure people who have other diseases apart from asthma about the safety of the vaccine.
Right, okay, thank you. Yes, that's a very good point, because as you say, we do know that the community with the underlying problems, there's high blood pressure also that people, and I think some of this are the issues that that causes this vaccine hesitancy, and if I may add, also possibly lack of information. So I'm hoping people will get the information that they need from this meeting and future meetings, but the opportunities are there to talk to their healthcare professionals and the GPs to get the information. Another question here, what tests have been done to come to the conclusion that vaccines are safe? What tests have been done to conclude that vaccines are safe? And I think, Dr. Chaudhuri, that you alluded to that when you gave us the mechanisms, when you gave the diagram around the vaccines and what it does and how it protects. So do you want to add a little more, because this question was posed after you'd done your presentation, so it's possible that this person has not quite understood. So it'd be good to go over it just once more, please, because that's why we're here. We want people to feel that they have got the information in order they can make those informed choices.
Sure. So essentially, the vaccine development process is a very highly regulated one. So once you have to first submit the idea of which type of vaccine development you want to have. So for instance, I talked about the virus, inactivated virus versus mRNA versus other types of technology. And then that has to go through a process of approval by a safety committee. And once it's approved, it then is conducted in a trials. And that's why we look for clinical trials. Remember, we had to wait for approvals of all these vaccines in December time. They couldn't just be rolled out as soon as the paper was published. It had to be approved. So during the whole process of the trial, there's a strict safety committee, what we call in clinical trials, SAE monitoring and AE monitoring. So that serious adverse events and adverse events, if any such occurs, either in the active or the placebo arm, it will be monitored, it will be recorded, and then the committee, usually an internal committee, will then look into why that happened. So that's a safety system that has worked very well in clinical trials over the years. And then once, particularly since it's a vaccine, once it's approved, then for the licensing, it has to go through an external body. In this case, in the UK, we have the MHRA, who would then look at all the data and look at all the safety, all the side effects, and then make the final decision. No, this is safe. The risks are acceptable if there are any risks, and the benefits far outweigh whatever risks we might have. So in spite of such rigorous examination of the vaccines, in this case AstraZeneca or the Pfizer, the Moderna, the three that are here available, there's been no emergence of any serious problems, apart from occasional reporting of side effects, as you would expect in any major trials, which have included thousands of patients. So I think that really should address the safety concerns. And this is in spite of the fact that the rollout and the process of development was terrifically fast.
Okay, great, thank you. So sorry, did you want to say something? Professor Fenton, were you going to say something? Okay, well, I have another question here which says, many of us may have already had COVID, but don't know because we've not been able to have tests. If so, we may already have antibodies. Why can tests not be done first to see if this is the case before taking vaccines? So open to any one of you, really.
Well, I can talk a little bit about that,
Dr. Aitken. Thank you.
Yes, so my understanding, and I can give you also a personal perspective, is that the antibodies are not long lasting. And so therefore, if you've had COVID, over time, those antibodies will then fade away. And secondly, there are different strains circulating of the coronavirus, and the vaccine can give you protection against all of the strains, whereas the antibodies that you may have produced would only be against one strain. That's my understanding. And then I can give my own personal story in that I had COVID back in February last year. And in May, all healthcare professionals were tested to see who had antibodies and who could work safely with protection. And by May, my antibodies had disappeared. I was no longer protected. I had to carry on hand, space, just like everybody else. I had no conferred immunity having had COVID. So the antibodies are not long lasting at all. That's my understanding. And I know the scientists are going to come and give an even more detailed explanation.
Please do, the scientists among us. Anyone else?
If I can add to that, thank you, Di. There is a government study called the Siren Study, which we were very, very proudly took part in. We recruited actually 500 people to that study, and those of you who took part, this is for healthcare professionals who are tested every 2 weeks. And so for blood and COVID swabbing, so if they do get in COVID, we will pick up what happens to their antibody in the long term. And the initial data of that has been published now, in fact, was in the media news. And it looks like if you get COVID infection, you get about 83% will have a protection up to about 5 months. And then it tails off, as Di just said. So you don't get long-term protection from the actual infection itself. And whereas the vaccine gives you a much longer period of protection. So, and I think to some extent that brings a bit more granularity to that, what Dr. Aitken just said. So yes, you can have a protection, but it's actually for the short term.
And just to remind everybody that if you have had the infection before and it was confirmed, you can and you should still have your vaccine, and you have to wait a particular period of time between being actively diagnosed with COVID and getting your vaccine. But it is in everybody's interest that irrespective of whether you think you may have had it or whether you had it before, that you plan to get it when it is offered to you, because that gives you, as you've heard from the doctors, the most robust and strongest antibody response and protection. The vaccine is far more effective and powerful.
So just to go back from Dr. Aitken's point, where she'd had COVID, so there is this discussion around that having had COVID, you still have antibodies, and that the antibodies are there for a period of time. So are you saying that this is absolute nonsense? Once you've had COVID, whether you've had COVID or not, it's in your interest to get the vaccine. Is that what's being said, Professor Fenton? I'm looking at you.
Oh, sorry, I thought you were speaking to Dr. Aitken. Yes, absolutely. That, because many people may have been exposed to the virus and they don't know whether or not they have COVID. People may think they do. I would like everybody in that case to make sure that they get the vaccine so they're absolutely sure that they're protected. For people who did have confirmed COVID, and it may have been months ago during the first wave or even at the beginning of the second wave, I would strongly recommend that they also get the vaccine as well to offer them the maximum protection that they would need for the virus and against the virus.
Okay, thank you very much. A question for you, Professor Fenton, very clear, it's for you, this one. And it says, how might we encourage BAMEs to have the vaccine? We know what the science states, but I'm assuming the reason for reservation is multifaceted. I think you've more or less responded to that, but
yeah. So thank you, Councillor. It is multifaceted, and I think we should be really careful that we don't blame communities, right, for asking legitimate questions, for expressing concerns, and as a community member myself, it is also our responsibility that we seek information from reputable sources, and then when provided with the facts, we're open to changing our minds, right? Because we have new information. As a scientist, this is what I do, right? So we do research, we get information, and then we build our hypotheses and then change our practice. So there are many reasons why people may be hesitant. As we said earlier, it's a new vaccine. I know many community members are saying, you know, I want more people to have it before I get it, right? Well, we now have 25 million people who've had it across the country. I think it's time now for us, for those who've been waiting, to begin to get the vaccine. There's some people who are concerned because they're not sure about the safety and effectiveness and the content of the vaccine. And we've been able to address some of those questions today in terms of the profile and the content. And then there's some people who are just mistrustful, right? So they say, you know, well, government hasn't prioritized me before. Why are they prioritizing me now? There are some people who say, why didn't they put Black and Asian minority people at the beginning of the list? And there are other people who say, you know, you shouldn't put us, don't target us as BME communities. So you will have people who are mistrustful, and often for good reasons, because of their historic experiences or because of their day-to-day lived experiences. And for that, all I can say is, you know, we're spending time to talk about these issues and to ensure that we have honest and authentic conversations about the issues. Because, you know, when I look at this from the public health director for the city, I want us to return to some normality. I want us to not to have to stay hidden in our homes to prevent the virus from being transmitted. And I want to ensure that all of us have a chance to see our elderly parents and relatives, to be able to send our kids to school feeling safe and to be able to engage again. So those are some of the things that I've heard about why people aren't taking the vaccine that we're addressing tonight. Thanks, Councillor.
Thank you. And I think the issue of trust is a very important one. It's a main one that I hear. One of the trust with experiences in the NHS. This is a major one, major factor. And someone says here that Black people have been mistreated at work, then by the NHS, access to PP or lack of access. It says that the BAME communities are not any more hesitant, but the government and media gave the impression that when we have similar concerns as other groups, we're not being given timely information from the government. So there's something here about, is that continued mistrust that Black people, BAME communities are not considered part of the equation, certainly at the beginning. And also there is, this is not a question, this is an observation from myself, when with the Prime Minister's daily briefings, there were so many concerns around the Black community that were a Black BAME community, if you like, that where there should have been people like yourselves, professionals, people of colour, who would then bring out the trust, because the communities felt that you would be speaking to them directly, that they were included. But people like yourself and Dr. Chaudhuri were not visible at those briefings. So what do you have to say to that? Were you ever approached to share these briefings, or was this not considered?
So I have done the briefings. I
missed you.
Yes, I was there just before Christmas. You'll remember, just before London went into Tier 3 and then Tier 4 a couple of weeks later, and I spoke to the nation about the importance of all of London pulling together and you know, taking heed of the guidance. But your point is correct, and you know, I know Dr. Aitken, Dr. Juliet, and others will have their view on this. You know, we have a choice. We have a choice that says we're in the middle of a pandemic, and we are now trying to find a way out of this pandemic. And we need to do what we need to do to protect ourselves and our family members. So that choice becomes, do we take advantage of the most effective tool we have to protect ourselves? Or are we going to say, actually, I'm not taking this tool because I don't trust the system, and so therefore I'm going to continue to put myself and perhaps my family community at risk? Or is there something that we can do together to allay your concerns, so you take the vaccine and you continue to advocate for greater equality and justice, and you know, continue that fight? So I you know, there's so many ways of expressing how we feel, and I want us all to express how we feel, that frustration and anger with so many things. And at the same time, I want us to protect ourselves as well.
Okay. Dr. Chaudhuri, do you want to add anything to that? I can see you're desperate to say something.
No, not really. I was totally happy with Professor Fenton's reply. I totally agree. I think the other message really is that it's also protecting your own family and friends. It's just not about ourselves or the person who's taking the vaccine, because this virus really, which has really destroyed so many things about what we normally take for granted in life, is also the fact that unknowingly one can spread it to others, and vaccine also is something that's effective there, and that's again a message that came out very strongly.
Thank you. Dr. Aitken, do you want to add, because you've been around the community for 30 years, I've seen your video taking the vaccine. You're doing everything possible to get,
Yes.
to build that trust. So what do you have to add to this?
Well, I do agree with the questioner in that it would be nice if Kevin had more of a national profile.
Yes.
I did see his briefing, the Prime Minister's briefing, and I cheered out loud when I saw him at the podium. But otherwise, he's had to go around every different borough. I even saw you in the Manchester one. I think there was a Manchester one doing these talks, and it would be nice if, given his prominent role, he had more of a national stage.
Absolutely.
For myself, what I would say to people is, as well as spreading the word of the knowledge of what we know, just be careful with your social media, guys, and think twice before you forward on any social media videos or stories. Do you think this has come from a trusted source? Is it really reputable? Because if you forward it automatically, you could be spreading some of the mistruths about the vaccine. And what we're here to do tonight is actually talk about as much truth as possible and not confuse people, because even healthcare staff have fallen prey to some of these videos that aren't telling the truth, and it's a real shame. So even as healthcare professionals, some of us have had to reevaluate the evidence and then come to a new conclusion, and that affects communities, because as healthcare workers we are asked by our networks all the time what's our opinion, and our opinion is really, really important.
Yes, it is, because as GPs, medical professionals, you carry a great deal of trust with the community. So yes, I believe that they do listen. You mentioned your mum earlier. My own mother, she was persistent. She kept ringing the GP. When am I going to get my vaccine? When am I going to get my vaccine? She was becoming a pest. And now she's had it. She feels great. She's 90, by the way, and she was desperate to get this vaccine. So, it's that trust. There are elements of trust. There are people who do trust. But I take your point around social media. It just breeds this distrust, and it spreads. And if you have people who are still a little confused, unsure, then this adds to the confusion. So it's just a vicious circle. It's something that we need to really be aware of, and do our best as much as possible as we possibly can to have these meetings to allay people's fears.
Can I just come in here?
Yes, of course.
As I have said before, I spend a lot of my time trying to dispel myths, conspiracy, and misinformation. And as Professor Kevin said, it is important where one gets one's information from. And it is not only where one sources that information from, it is whether it is credible. And I quite agree with him when he says the information must come from a reputable source. And that is important. And yes, I'd like to see the experts here today more often on the television, but I like the way Professor Van Tem puts it. He always uses a football analogy. I'm saying I hope he's an Arsenal supporter. But lastly, Years ago, I had treatment for prostate cancer. I had radiotherapy. And did I grill my GP about this vaccine? And he assured me of its safety, of its efficacy. And I even grilled him about the side effects. And I had to say to him, you were absolutely right.
Thank you very much. Can I bring in Catherine? Are you there? It's Catherine Flynn from the NHS Lambeth. Catherine, are you there? Would you like to say something? Because I think you ought to come in on here.
Oh, hello everyone. Thank you very much. I'm just in the team that helps to gather together some of the information about the vaccines that anyone can access. So we know that there are lots of places on different websites where there is information, and it can be very difficult for people to know exactly where to look. And so what we've tried to do in our team, which works across the whole of South East London, is gather together things like the leaflets about what to expect when you get your vaccine in lots of different languages that Public Health England have produced, some of the information from NHS England, so lots of information from different sources that is all verified, checked, reliable, good, solid advice, and we've tried to put it in as plain language as we can as well, because we know that sometimes you know, medical people and clinical people and academics can complicate things and make it, sometimes when they try to explain things, can sometimes make it even more confusing. So I would, and that's just because that's their training, you know, when you live in one world, that's the language that you speak. So I'm hoping that having people speak, you know, directly this evening is helpful. And obviously, if you don't have an answer to a question that you wanted to, or you didn't quite understand it, you can please put a follow-up question, and then we'll try to make sure that our experts do, you know, explain a little bit more clearly. But if anyone wants to go away after this session tonight and have a look at some of the information, you can go to the NHS South East London Clinical Commissioning Group website. So it's www. Hopefully one of my colleagues can put this in the chat, because I can't actually put anything in there this evening. www. S for sugar, EL London ccg.nhs.uk, and we've put things, lots of questions, some of them that you've asked already this evening. So what are the ingredients of a vaccine, for example? We've got a kind of quick answer to that question, and then it links you to actually what the whole list of ingredients are to the vaccine, so you can have a look for yourself if you want the answers to those questions. And I would say, if the answer that you would like isn't there, there's also a place for you to just contact us and put your question, and then we'll publish it up on the website. So thank you very much.
Thank you, Catherine. And I think Juliet, you should come in out here, because you provide information, you're working with the community. So how do you feel this sits? It's about the trust, and how do we disseminate information to our communities to ensure that they're getting the right information to make those choices?
Thank you, Councillor Winifred. Absolutely. I think one of the things I'd say is that this event tonight is just one of many, and we want to keep having the conversation. There's lots of work that we're currently doing and have done. So there was a big event at the Ruach City Church that Dr. Aitken was involved with. We've done a pop-up clinic at the mosque. There's lots of information that's been translated into many languages, so it's accessible. We're also doing some work with the Portuguese and Spanish speaking communities and the Somalian community. So I think what I would say is that you know, the more we can understand what is helpful from the community's point of view in making the decision, but having the conversation, because I think the important bit is people feel really well informed. So I think I would really just advocate for, if people feel there's something that we could do differently, or deliver differently or be more creative about them, please do come back to us. But the other thing I would just like to add, that's probably more for the doctors than me, but just the need to still continue to wear masks and wash our hands and stay safe. So even when we're having the vaccine, and you know, even if you've had COVID, it's still so important that we're still protecting ourselves and our communities by doing what we've been doing for the last year. But yes.
Thank you very much, Juliet. I will go for one final question. I think it says Dr. Fauci of the US says the vaccine does not protect against new strands of the virus. He says only the mask will do that. Is that correct? How about this would be a good question to end with? Is that correct? This one has your name on it, Dr. Chaudhuri.
Thank you for that, Councillor. Again, it depends on what new variants we're talking about. As you probably know, that there have been several, one from the UK, and in fact there's a second appearance of emergence, another one from Bristol, but also abroad we have the South African variant, we've had the Brazil variant, and Brazil variant has been of 2 different types, for instance. Broadly, however, the vaccines that we have here, which is Pfizer, Moderna, and the AstraZeneca, at this moment in time, all show efficacy against the variant ones, except very rare variants, which we haven't had, thankfully, in emergence here. And that efficacy is greater than what you would have from flu vaccine. So, you know, broadly, we can say that, yes, they are effective, but clearly there are concerns. That's why the travel and other things have been stopped till the whole thing comes under control. But I don't see any specific issues with the variants that we have here, with the virus, with the vaccines that we have here too. So that would be my broad response. I'm not sure what Professor Anthony Fauci in the US is alluding to. I know he comes to TV and the CNN very commonly, so much so I heard that in the US, a vaccine jab is now called as Fauci ouchie. I think he might be alluding to a separate type of variant. So that would be what I am at least aware of. I don't know whether Professor Fenton and Dr. Aitken or...
Well, let me just come in here before you respond, Professor Fenton, because there's one last one which I think you will and Dr. Aitken may want to come in on. It says, is it not possible that these new strands represents the virus reproducing itself in response to the vaccination, like the development of superbugs that has occurred in response to antibiotics?
So no, that's not the case at all.
Okay.
In fact, the faster that we can get everybody vaccinated is the more protection we have against these variants appearing, because the immune system will sort of kick in and prevent that transmission from occurring, and therefore the likelihood of mutations occurring. Remember, mutations occur when you have sort of uncontrolled spread of the virus, either within the community or especially in people who may have severe immunocompromise and their body isn't able to mount an immune response, and therefore the virus spreads and multiplies very quickly, and so mutations occur. So in fact, getting vaccinated and having high levels of vaccination within the community is a fantastic way to help to control the variants from appearing. And that's why in Israel, where they've actually moved very quickly to vaccinate their population, they have high levels of coverage, their rates are coming down, and they will be better protected from mutant strains. So let's be absolutely clear that high vaccination is one of the things we can do to protect ourselves from mutations occurring, and of course to limit the spread. And I also wanted Councillor to address the Dr. Fauci question. I worked in the US for many years, and Dr. Fauci is actually a very good friend of mine. I worked with him very closely, and he's an excellent communicator. And I think what he may be referring to, well, what I've heard him speak about is that the importance of, first of all, everybody getting the vaccine, because it's the best way to control the pandemic and to get back to normal lives. But he also says that, you know, once you've been vaccinated, don't let your guard down, because until all of us are protected and protected well, there's still going to be virus circulating. So we will need to continue to practice hands, face and space, wearing masks, especially in crowded spaces, in order to protect each other. So we have to get the vaccine and have high levels of coverage. And until that time, we need to be continuing to protect each other as well.
Thank you very much. Dr. Aitken, did you want to add something?
I'm fine with this one, thanks.
Okay. Fenton, did you want to add something?
No, I'm fine with this one as well.
Okay,
thanks.
great. Well, I'm very conscious of time, so what I'm going to do is I'm going to go around and ask each of you for a final comment or statement to the community that we are addressing, and how to, you know, in getting people to think positively about the vaccine and to be vaccinated, so that we no longer have this vaccine hesitancy, but we're looking at proactively and going forward and taking our vaccine. I'm hoping those people who are listening in will have had some of their questions answered, and if not, do please, as Professor Fenton said, it has your information must come from a reputable source. Get the right information to make the right choices, so you're making informed choices. So, Dr. Chaudhuri, can I begin with you? What would you like to say to the community? 2 minutes.
Right. So I think the important message from my angle, or from the medical, the healthcare professional in the hospital side, would be that I think the most important message is take the vaccine. And whenever this is offered, whichever one you're offered, it's really important to go with the vaccine. As Professor Fenton said, the emergence of the new variants is also linked to the number of infections around us, and with the vaccines, you do reduce the infection rate. I would also say that if you have concerns about vaccines and side effects, which many people can quite rightfully have, it's best to speak to professionals as much as possible, the general practitioners, the hospital specialists, or your healthcare worker, whoever. At least let the evidence come from there rather than social media.
Thank you very much. Dr. Aitken?
Hello there. I'd like to say, have a good think about what you're looking forward to when the lockdown ends. Are you looking forward to travelling on holiday? I'm of Jamaican heritage, and I know I can't wait to be able to book a holiday in Jamaica. Are you looking forward to hugging relatives, people who have been, under lockdown, and you're not being able to hug them fully? Are you looking to going back to work? Maybe you work in an industry that has been shut down, and therefore, your job may potentially be at risk. These are a few of the many reasons that you could think of having the vaccine.
Thank you.
Protect yourself, protect your family, get a holiday.
Right. Thank you. Reverend Bowman.
Thank you all for having me this evening. When I saw the panel, I started to get nervous. I says, my God, I'm a theologian. What's the matter with these people? But let me just say this. As Sister Juliet said, let's keep having a conversation. As Sister Juliet said, let's keep having a conversation. This is very important. This year and last year, I have lost many friends from this thing, and it hurts, it pains. And let me say this, lots of Black men are dying every year from prostate cancer. Why? Because they're afraid to go and get tested. I have had treatment for prostate cancer, and I am alive to tell the tale. And the reason that they're dying is because they are afraid to go and get tested. And that comes. And lastly, if the vaccine assists us in building immunity to the pathogen, then it's worth the effort in taking it. because none of us are safe until the whole community is safe. And thank you all, and whatever gods you pray to, may God bless you all.
Thank you very much, Reverend Bowman. Professor Fenton.
Thank you again, Lambeth, for this event. You know, we can never have enough conversations about the vaccine, about health in our community, and about the future. And I'm hoping that, you know, what we're starting here, we will continue, because this sort of questions, this honesty is really, really important for our health and our community's health. My reflection is, I stand here a year into this pandemic, and I recognize how privileged we are in this country to have access to a vaccine. In Europe, they're fighting over vaccine access. In many countries, my parents are in Jamaica, they haven't yet got sufficient vaccines to vaccinate the most vulnerable. I understand the privilege that we have to have the vaccine when many people around the world don't. And so whatever I can do to encourage people to get the facts, ask the difficult questions, but make a positive decision to take advantage of this opportunity, I will do this, because I would rather have us being healthy to fight another day than for us not being healthy because of COVID.
Thank you very much. Aitken.
Thank you, Councillor Winifred. So just, I was reflecting on this as well. So it's been a year since we've been into sort of the first lockdown and the pandemic was declared. And in Lambeth, we've had about nearly 24,000 positive cases diagnosed. Sadly, about 500, just over 500 people have died. And, you know, this disease hasn't affected everybody equally. There's been so much inequality in deaths and admissions to hospital and so on. So I think as Professor Fenton was saying, I think it is a real privilege. I mean, it's amazing that the vaccine has been developed so quickly. Normally, you're waiting for years for a vaccine to develop for you know, your common diseases like measles, mumps and rubella, polio. Took years. But this is amazing. We've got several vaccines on the scene which are safe and effective. So definitely, I encourage you to all take it. I've taken it. My dad, who was hesitant, he's 91, he's taken it. He was hesitant initially, but he's turned around. He's due his second vaccine this week. So that's amazing. Thank you.
Thank you, Aitken. Juliet.
I think firstly, I'd like to thank everybody who's attended and all the questions, because I think without those questions, it's really hard to have a conversation and start discussing what the issues are for people. So thank you for those who submitted the questions both before today and during the session. I think, like my colleagues, really, I mean, I clearly have a perspective that this vaccine is a really positive way of us protecting ourselves. But I'm also very aware of people being hesitant or worried or having concerns. And that's why I think the conversation that I keep saying is so important, and that we keep having the dialogue and we keep talking to all of our communities about what will be helpful, and that might be different for different parts of our community, but we need to carry on with that dialogue and carry on talking about what is going to give a positive outcome. And I'd like to thank all the members of the panel for joining us in doing this webinar, because I think it hopefully will have had a big impact on the community and people's decision making.
Thank you very much. And I would like to say that as we come to terms with our losses, we also come to terms with our lives, our futures, and those around us. And we need to do all we can to continue to keep one another safe and keep talking about the vaccine so that we can share with each other the positives and in going forward. And I would like to thank you all this evening for your contributions. Dr. Chaudhuri, thank you very much. Dr. Fenton, I look forward to seeing you again soon on TV or not. Juliet, Aitken, Dr. Aitken, great to see you. You know, we're the stayers in the community. It's lovely to see you again. And Reverend Bowman, lovely to meet you. It's the first, and I hope it's not the last time. It's been a pleasure having you here this evening, all of you. So thank you very much. and to thank the technical team behind the scenes. They've kept us going, and I wouldn't be able to do this without them. And Catherine, thank you very much for your contribution. Thank you all. And this is one of many meetings, and I hope we will meet again. And take care of yourselves and stay safe. Thank you very much indeed. And to our listeners, those who've logged on, thank you very much. If we've not answered your questions, there will be other opportunities to answer those questions. So thank you and keep safe. Take care. Bye-bye.
Thank you.
Bye.
Bye.